Good day, everyone. My name is Chris Daniel Sumawang, and I am a student nurse from Tarlac State University from BSN 2B. And for today, I will be performing a performance evaluation checklist about the administration of oxygen via nasal cannula. So first thing that we need to know is the purpose of our performance. So first is to deliver a relatively low concentration of oxygen when only minimal oxygen support is required. Next is to allow uninterrupted delivery of oxygen while the client ingests food or fluid. So next thing that we need to do is we need to uh, move on to our assessment phase. So first we need to assess for our clients uh, the skin as well as the mucous membrane for color. Next is the breathing patterns as well as the chest movements, chest configuration, lung sounds audible by auscultating or by ear. And lastly, for any presence of clinical signs of hypoxia and hypercarbia. So let's assess our patient. So good day po ma'am. My name is Christina Lamsmang and I'm a student nurse po from Tarlac State University from BSN 2B. And I will be your nurse for today po. So for today po ma'am is assess ko lang po kayo. Okay lang po. Check ko lang po yung inyong pong skin color as well as yung ating pong kulay ng mucous membrane. Okay po. And also i-check ko lang din po yung inyong pong paghinga. Is that okay? Okay. So okay po. So check po muna natin yung inyong pong skin. Pwede ko po bang tanggalin po yung pong blanket? Sige po. Okay. And pwede po ba natin i-open yung map po natin? Okay, check ko lang po yung kulay po ng ating mucous membrane. Okay. Okay, thank you po. And now for our ask ko lang po kayo to take a deep breath. Okay. So deep breath po. Ready? 3, 2, 1. Okay. Thank you po. So next is for the okay and after that we will need to go to our next step, which is for our planning phase. We need to assemble our equipment. We do need to have a oxygen supply with flow meter and adapter, and also we need a humidifier with instilled water or tap water, and according to the agency protocol. And also we do need to have a nasal cannula and tubing. So here is it. Okay. So for the adapter and the flow meter and humidifier, you can see it here in our tank. Okay. And after that, we will now proceed to our next material, which is for our optional material. We do need to have a tape. Okay. And now we will proceed to our implementation phase. So first thing that we need to do, we need to determine the need for the oxygen therapy, and we need to verify the order, okay, of the therapy. And after that, we will need to prepare our client and the support people. So first thing that we need to do is we need to position our client to a semi-Fowler position. So ma'am, angat lang po natin konti into a semi-Fowler position. So sasandal lang po kayo. Okay po? Ito po yung 3, 2, 1. Okay. And after that, we will move on to our next step, which is we need to explain that the oxygen is not dangerous when safety precautions are observed. Okay, so ma'am, for today po is mag-administer po tayo ng oxygen therapy. So huwag po kayo mag-alala, oxygen is very safe po para sa atin. Okay po? Okay. And for our next step, which is for our performance. So first thing that we need to do is we need to introduce ourselves to our patient and we need to verify the patient's identity. Okay, so good day po ma'am, my name is Christina Lam Sumama as I have said earlier. So for today po, I will be your student nurse. Is that okay po? Okay, so may I know your name po ma'am? Okay, how about your birthday po? Okay, so may I see your wristband po? Okay, thank you po. Okay. And now we will be explaining the procedure to our patient. What are we going to do and why is it necessary? Okay, and if the client can cooperate. Okay, so for today po ma'am, mag-a-administer po tayo ng oxygen administration. So, or oxygen therapy. So, ang gagawin lang naman po natin is I will be inserting po a nasal cannula po sa inyo pong nares or sa ating pong ilong. And that is all po. So you may feel a little bit discomfort lang po upon inserting po yung ating pong outlet prongs. Okay lang po. So will you cooperate with me po? Okay. And also we will be discussing the how the effects of the nasal or the oxygen therapy can help to or will be used in performing or preparing or planning for the further care as well as treatment. Okay. So for today po ma'am is magkakanda po tayo ng oxygen therapy. So it is very important po for people who needs a respiratory help po. So this would increase po yung atin pong airway for our breathing. So this is all usually conducted po for people who have difficulty of breathing. Okay po? Okay, thank you po. And for our next step, we need to perform hand hygiene and observe other infection control procedures. So for example, I have, upon entering the client's room, I have already washed my hand. What I will be doing now is just spraying my hands with an alcohol solution. Okay. Until the alcohol dries. Okay, and after that, I will need to provide some privacy for my client by closing the curtains around the bed and closing the doors to the room if possible. Okay. If the client is near the window, you should also close the window as well to provide some privacy. Okay, so for our next step, we will now be setting up the equipments, the oxygen equipments and the humidifier. Okay, so what we're going to do, we will need first to attach the oxygen or the flow meter to the oxygen tank, or to the wall outlet. And we need to make sure that it is in the position or off position. Okay, so as you can see here, I have already put the flow meter into the tank. Now we will proceed to our next step, which is we need to, if needed, we need to fill the humidifier bottle. Okay, so after that, we will need to attach the humidifier bottle to the base of the flow meter. So as you can see here again, we have already placed the humidifier bottle to the base of the flow meter. And after that, we will now proceed to our next step, which is we will be attaching the prescribed oxygen tubing to and the delivery device to our humidifier. Okay. Now that we have attached the tube, the oxygen tube to the tank, we will now move on to our next step, which is um, we will need to open the or turn on the oxygen and at a prescribed rate, and we need to ensure that the we need to ensure for proper functioning. Okay, and to do that, we will need to first to open the or turn on the oxygen tank. Okay, so for example, I am uh, turning the valve, and the oxygen starts to flow, and we need to make sure or check that the oxygen is through flowing freely through the tube, and we need to remember that there should be no kinks and the connection is should be airtight. Also, we need to uh, note that there should be a bubble to inside the humidifier bottle, and also we should hear or we should feel the oxygen coming out from the outlet of the cannula. So as you can see here, I can see that there is a formation of bubbles inside the humidifier bottle, and now I can feel the oxygen coming out from the outlet of the cannula. Okay, so now for our next step, we will need to uh, apply the uh, apply the apply appropriately the oxygen delivery device, and to do that, we will need to put the uh, cannula to the client's face uh, with the outlet prongs fitting to the client's ears, and with the tube hooked to the client's ears. Okay. So ma'am, can you stay still po? And we are about to insert po yung atin pong oxygen tube. So you may feel a little bit discomfort lang po. Okay po. Okay, so behind the client's ears. Okay. So we need to make sure, or we need to take note that if our tube does not stay in place, we will now use our optional material, which is our tape, to hold it in place. We will be taping it on the client's side of the face. Okay. Okay, that should do the trick. So for our next step, we need to assess our client regularly. To do that, we will be assessing the client's nares. We will be checking if there are presence of any incrustations and irritations, and we need to apply a water-soluble lubricant as required to suit the mucous membrane. Okay? So, ask ko lang po ma'am if you are experiencing irritations and discomforts po coming from the outlet prongs. Okay. So, wala naman po. And if you have any concerns po or discomforts, just tell me po, as we could put a water-soluble lubricant po sa ating pong prongs. Okay. Also, we will be checking the client's ears, or we'll be checking the client's top ears, for any irritations from the tubing. And if there are present, we will need to pad the patient's ears, as it could help alleviate the discomforts coming from the tube. Okay, so how about sa ears po natin, ma'am? Are you experiencing any discomforts po? Like, masakit na po ba yung ating ears? Okay, so wala naman po. Good. And after that, we will move on to our next step, which is we need to inspect our equipment on a regular basis. Okay? And first thing that we need to check is the liter flow and the amount or the level of water inside the humidifier every or in 30 minutes and or when we are providing care for our client. Also, we will need to make sure that uh, the tube or the water inside the tube is not collecting independent loop inside the tube, and that is for our performance in our administering an oxygen to our patient. And now we will need to document our findings to the client's record using forms or checklists that is supplemented by the narrative notes if applicable or if appropriate. So for example, this is our nurse or our patient's chart. We will need to uh, document that we did a administration of oxygen. And now for our evaluation phase. So first thing that we need to do is we need to perform a baseline findings or baseline data or findings that may deviate from that is deviated from expected or normal for our client, and we will need to relate this findings to the previous data available if available, and also we need to report any significant abnormalities or findings that may deviate from normal to the primary healthcare provider. And that would be all for the performance of the administration of oxygen to our patient via nasal cannula. Again, my name is Chris Daniel M. Sumawang, and I am from BSN 2B. Thank you.